Sudden cardiac arrest can happen at any time. Immediate defibrillation and effective CPR can improve someone's chances of survival by up to 70%. Using a Mediana A15 AED is easier than you might think. It can be used by any bystander, even without training. Look out for any possible danger that could affect you, your casualty, or passers-by. Then try and wake the person, and if they do not respond, call 999 or 112 from your mobile. Then shout for the Mediana A15 AED. If the casualty is at risk of further injury or in contact with water, carefully move them to the nearest safe and dry place. Remember, stay away from any wetness when delivering shocks, as water conducts electricity. You need to start performing the ABCs as quick as possible: airway, breathing and circulation. When a person is unconscious, their muscles relax, so the tongue can block their airway. After looking into their mouth to make sure the passage is clear, tilt their head back to open the airway. Next, with your head by their face, look to see if their chest is moving and feel for breathing on your cheek. Do this for no more than 10 seconds. If the person isn't breathing, then begin CPR. Place your hands on the center of the chest, interlock your fingers and press down hard on their chest, compressing by a third. Repeat this at a rate of approximately 100 to 120 compressions per minute. Once you reach 30 compressions, blow 2 breaths that are over 1.5 seconds long directly into their mouth, and then continue for 2 minutes with a cycle of 30 chest compressions to giving 2 breaths. Open the lid of the Mediana AED. This will turn the power on. The electrode pads are pre-connected, but if for some reason they are not, the machine will tell you to
insert connector firmly, plug in pads.
Once this is done correctly, the machine will tell you to
remove clothes from the patient's chest.
Make sure to also remove anything that may contain metal, like jewelry and bras, as the metal conducts electricity and can cause burns. Remove the foil packet on the pads and select the option for Adult on the front of the unit. You will then be instructed to
place pad exactly as shown in the picture. Press pads firmly to patient's bare chest.
If the person has a lot of chest hair, you may have to shave them. The unit may have an accessory prep kit, which includes a shaver. Using the picture guide, place the green pad under the right collarbone, then place the red pad beside the left nipple, just on the ribs below the heart. If the person is 1 to 8 years old or weighs less than 25 kilograms, press the switch to paediatric and apply the green pad to the chest and the red pad to the back. Make sure the sticky pads have good connection with the skin. If the connection isn't good, the machine may repeat the phrase, check electrodes. Once the pads are applied correctly, the machine will say,
analyzing heart rhythm, do not touch the patient.
If a shock is required, the unit will say,
shock advised, charging, do not touch the patient.
When the AED is ready, it will tell you to
press the red flashing button now, deliver shock now.
The unit will tell you when there has been a
shock delivered
and when it is safe to
touch the patient.
You can now
begin CPR.
After the shock, leave the pads attached and immediately resume giving CPR. The unit will sound a metronome for you to keep rhythm to. Stay with the patient until the paramedics arrive, as there's always the chance they may have another cardiac arrest. Congratulations, you now know how to save someone's life with a Mediana A15 AED.